This is the epicenter of a measles outbreak.
Measles in the U.S. just hit the highest number of cases in more than 25 years. That's according to the Centers for Disease Control and Prevention. Even more alarming, the agency says, if measles is not contained, the U.S. will hit a major public health turning point.
It takes a full year of sustained transmission within the U.S. to lose elimination status. And right now we're about, 3 or 4 months away from that.
Measles is really scary because it is so contagious. If a person with measles is in a room with 10 other people who are unvaccinated, 9 of them will get measles.
Since September 2018, there have been measles outbreaks in more than 24 states. The CDC defines an outbreak as 3 or more cases. New York City and Rockland County, New York, have the biggest and longest-running outbreaks since the measles was eliminated in the U.S. in 2000. Doctors at the CDC say these cases have been spreading among unvaccinated children in ultra-Orthodox Jewish communities. To prevent measles from spreading, the CDC says almost all, 95% of the population, needs to be vaccinated. Laws in all 50 states and Washington, D.C. require public school students have an MMR, measles, mumps, and rubella vaccine. All of the states and D.C. allow exemptions for medical reasons, such as allergies or for people who are immunocompromised because they are being treated for cancer. All but 4 have religious exemptions. And 16 states have philosophical exemptions for families who don't believe in vaccines. In the wake of the latest measles outbreaks, some 10 states have considered eliminating or making it harder to get exemptions. So far in 2019, Washington State removed its personal belief exemption, and Maine removed philosophical and religious exemptions.
We do know that the easier it is to get an exemption, the more people have exemptions. So tightening that up can help with improving coverage.
Dr. Clark says right now, most cases in the U.S. can be linked back to someone who wasn't vaccinated, who traveled abroad and brought the measles home. The World Health Organization reports measles outbreaks in Israel, the Philippines, and Ukraine. The CDC keeps a do not board list. The Transportation Security Administration can stop airline passengers from boarding a commercial flight.
You can prevent somebody who either has measles or is highly likely to develop measles because they've had an exposure from traveling if they plan to travel when they're potentially infectious. It's kind of a tool of last resort, but it does allow health departments to be able to say, look, we can do this and we really encourage you not to travel and not to put other people at risk.
So far, at least 8 people in 5 states have been flagged for the do not board list. When contacted, those passengers agreed not to fly. Still, CDC officials are concerned that number could climb.